Do you sometimes notice your eyesight feels blurry or that small changes in your vision come and go? Many seniors shrug these signs off as just part of getting older. But what if I told you that ignoring certain vision symptoms could lead to sudden blindness in just a matter of weeks? Your eyes are precious, and once your vision is lost, it may never fully return. That is why it is so important to know the warning signs early. Today, we will go through 5 vision symptoms that you should never ignore after 60. Each one may look harmless at first, but in reality, it can signal a dangerous condition that can quickly damage your eyesight if left untreated. I promise to guide you step by step in clear and simple words so you feel supported and confident in protecting your vision. By the end of this video, you will know exactly what to look out for and what steps you can take right away. Before we dive in, we've also uploaded some helpful vision-related material inside a free senior health app, including trackers and simple guides. The link is in the description and pinned comment if you'd like to check it out. 5. Sudden blurred vision. Imagine you are reading your newspaper in the morning and suddenly, the letters begin to look fuzzy or doubled. You blink, rub your eyes, and maybe even clean your glasses, but nothing helps. This type of sudden blurred vision is not just about tired eyes. It can be a sign that the blood flow to your eye is blocked, or that your blood sugar levels are changing too quickly. Seniors often face these situations when circulation weakens or when diabetes and high blood pressure put extra strain on delicate eye tissues. If blurred vision comes on suddenly, it may point to a problem with the retina, which is the light-sensitive layer at the back of your eye. In the worst cases, it may mean you are experiencing a retinal detachment or even a small stroke inside your eye. Both can cause permanent blindness if not treated right away. The scariest part is that this damage can happen in just a few days or weeks. That is why you must never ignore it. If you notice sudden blurry vision in one or both eyes, stop what you are doing and contact your doctor immediately. Acting fast can save your sight. Do not wait and hope it clears up on its own, because by then it may be too late. 4. Flashes of light. Have you ever been in a dark room and suddenly seen quick flashes of light, like sparks or lightning streaks across your vision? Some seniors think this is just eye strain or age catching up with them, but it can actually be a dangerous warning. Flashes of light may happen when the gel inside your eye pulls on the retina. If the retina tears or detaches, blindness can follow very quickly. The retina is like the film in a camera. Without it, you cannot see. Once it pulls away, the cells start to die and vision loss can become permanent. The trouble is, you only have a small window of time to act. Doctors often say if you get treatment right away, your sight may be saved, but delay can mean losing it forever. Flashes may also show up after a fall, when blood pressure spikes, or if the eye has been injured in the past. Seniors with diabetes, high blood pressure, or past eye surgeries face even higher risks. If you notice flashes of light in your vision, do not dismiss them as harmless. They are one of the most urgent signs your eyes are crying out for help. Call your eye doctor as soon as possible, even if the flashes stop after a while. Quick action can mean the difference between keeping your eyesight and going blind. 3. Dark curtain over vision. Picture this. You are sitting with your grandchild, enjoying a book, and suddenly you feel as if a dark curtain or shadow is falling across part of your sight. It may start small, like a shadow in the corner, but then it spreads, blocking more and more of your vision. This is a classic warning sign of retinal detachment. When the retina pulls away from the back of the eye, it cuts off the supply of blood and oxygen to the cells that let you see. Without quick treatment, those cells begin to die within days, and the damage cannot be undone. Seniors are more likely to face this because the tissues inside the eye become thinner and weaker with age. If you have had cataract surgery or you are very nearsighted, your risk is even higher. Some seniors ignore this symptom, thinking it will pass like a temporary cloud, But this is a mistake. The truth is, the curtain is not going to lift by itself. It means your retina is in serious trouble and the clock is ticking. Emergency surgery is often the only way to save your sight. If you ever notice a shadow, veil, or curtain moving across your vision, do not wait until morning. Seek help immediately. The sooner the retina is treated, the greater the chance of protecting your vision and avoiding blindness. If you're facing sudden vision changes, flashing lights, or dark spots, and you're over 60, this may be your warning sign. Thousands of seniors are already using a free health app that gives them simple tools to track symptoms, avoid risky habits, and feel supported every day. You'll find the link in the description and pinned comment. Don't miss it before it's too late. 2. Loss of side vision. You may not notice this one right away, but it can be one of the most dangerous. Loss of side vision, also called peripheral vision, means you slowly stop seeing things out of the corner of your eyes. Seniors often discover this only after bumping into furniture, having trouble driving, or noticing that friends or family seem to suddenly appear beside them. The most common cause is glaucoma, which happens when pressure inside the eye quietly damages the optic nerve. This nerve carries messages from your eyes to your brain, and once it is harmed, the damage cannot be reversed. The scary part is that glaucoma often has no pain and no early signs until it is too late. That is why doctors call it the silent thief of sight. If side vision fades, it may also point to a stroke in the brain or problems with blood circulation. Either way, ignoring it can lead to complete blindness. Regular eye exams are the best way to catch it early, but if you notice changes yourself, do not delay. Losing side vision is not something to ignore or accept as normal aging. It is a red flag that something serious is happening inside your eyes, and it needs attention before your sight is gone for good. 1. Seeing floating spots. One of the most common symptoms seniors mention is floating spots. These look like tiny specks, threads, or cobwebs drifting across your vision, especially when looking at a plain background like the sky or a wall. Most of the time, floaters are harmless and come from natural changes in the gel inside the eye. But if you suddenly notice a shower of new floaters, or if they appear along with flashes of light or a dark curtain, this is a serious danger sign. It may mean bleeding inside the eye, retinal tears, or even an early stage of detachment. Seniors with diabetes often face this problem because fragile blood vessels can leak into the eye. Floaters may seem like a small annoyance, but in reality, they can be a life-changing warning. If you see new floaters appear quickly or they suddenly get worse, it is time to act. Do not wait to see if they fade or adjust to them over time. Your eyes are sending you a message that something is wrong. Immediate attention from an eye doctor can make the difference between saving your vision and losing it forever. Remember, your eyesight is too precious to gamble with. If floaters arrive suddenly and in large numbers, treat it like an emergency. It could save your sight. Your eyes are windows to the world, and protecting them is one of the most loving gifts you can give yourself. Today we learned that sudden blurry vision, flashes of light, a curtain falling over your sight, fading side vision, and new floating spots are not minor annoyances. They are urgent warnings that your eyes need care right away. Ignoring them can mean losing your vision in weeks, but acting quickly can often save your sight. The good news is you are never too old to protect your eyes. Small steps like regular checkups, listening to your body, and taking quick action when something feels wrong can make all the difference. To avoid missing warning signs and to stay on a healthy routine, check the link in the description and pinned comment for the free senior health app. It's helping thousands of seniors feel more supported every single day. Always remember to consult your doctor before making changes and keep hope alive. With awareness and care, you can continue enjoying the beauty of life through healthy eyes.